Okay, so today we're going to talk about estrogen because the topic of hormones is really, really big, and it's very hard for us in the space of 1 hour or so to cover all the different hormones and all the different ways in which imbalance can occur and that wider impact across the body. So as a result, we're going to sort of break this down over the next couple of months and address different hormones for your benefit. We're going to talk about estrogen because estrogen is such a critical hormone for both actually males and females, but for females more importantly because it is the predominant hormone that controls many of the functions in the body, or it has an effect on many functions of the body throughout the reproductive years, and its deficiency has a significant impact on women's health post menopause. So that's why we want to discuss why we chose to discuss estrogen. But in addition, something that's really important to bring your attention to, latest research in COVID has shown that the presence of estrogen and progesterone has provided a more protective benefit for women over men in terms of prognosis with COVID and even contracting the infection. So we know more men are susceptible to COVID than females. And as as scientists dig more into the research, it's fascinating to see that those sex differences play a significant role. And you will learn today how estrogen's protective effects on cardiovascular health and modulation of the immune system it is what drives that benefit for women. So as we always do, it's important for us to share this disclaimer that, again, all the content of this presentation is for information purposes only. Should you have any health concerns or existing hormone imbalances, please do not use any of this information to self-diagnose or self-treat, but please seek the help of a professional who is expert in hormone balance. So what are we going to cover today? Today, we're going to talk about what are the drivers of hormone imbalance, give you a nice quick overview of estrogen in terms of its role, production, regulation, and breakdown. We're going to highlight implications of imbalance, mainly focusing on estrogen dominance and also estrogen deficiency. And then we're going to outline how to effectively test estrogen imbalance and provide practical ways on how to manage it through functional medicine and nutrition. But the key message, the key take home I wanted you to have today is that you can affect and balance your hormone levels without giving hormones. That's what we really want to explain to you today, that there is so much you can do in your hands in terms of your lifestyle that can have a significant impact on your hormones before we resort to chemical intervention. So what drives hormone imbalance? Hormone imbalance, it's really the key thing to think about it is how do we uncover the pattern within complexity? Because hormones are complex. They're not complicated, but they're complex. And there's many of them in the body that interact. And so we need to understand what is the pattern in order for us to address, to make the necessary changes to bring harmony in the body. So, oh, I have some mix up in my slide. Okay, so in terms of our old thinking was that the hypothalamus has through the brain, so the hypothalamus pituitary adrenal axis is what impacts the ovaries. That was our initial old thinking. You know, brain communicates with the ovaries, ovaries release hormones, and then there's a feedback loop, and that's how it's controlled. However, now we understand that the new thinking is that actually there's a much more complex web of interactions between that influence the ovary and subsequently the release, regulation, and metabolism of hormones. And in particular, it's the liver, the gut, and the adrenals. And we're going to discuss that today. We did cover this in quite a lot of detail in our PCOS talk, so I encourage you to watch that as well when you have the time. So, because of this deeper understanding that we have of the interconnectedness of the different roles that organs and systems play on hormone balance, we realize that as a result, there is many drivers that can push hormones to become dysfunctional and drive to the signs and symptoms that we see. So, things like genetic SNPs. So, if you have a mutation in your MTHFR gene or your COMT enzymes, or your cytochrome P450 enzymes, these can impact the way in which you metabolize estrogen. And we're going to talk about why that is important. Your food and your diet is so critical in impacting your hormones. So if you're eating a lot of inflammatory foods, that's going to drive insulin resistance, and that's in itself is going to drive hormone imbalance. And again, we cover that in quite a lot of detail in the PCOS talk. Toxins. So whether we're talking about external toxins, xenoestrogens, drugs, and so on, or metal toxicity like mercury, those have also a significant impact on your hormones. Because remember, hormones are extremely sensitive to the environment that they're in, be it the internal environment or the external environment. Excessive fat, chronic stress, inflammation or autoimmune conditions. Aging in itself has a significant impact on your hormones. So we see a decline in your estrogen and progesterone naturally as we age. Nutritional insufficiencies. So if you're unable to digest and absorb nutrients, or you're not taking enough nutrients or having a balanced diet, that's going to have a significant impact in the way you produce hormones and the way you metabolize hormones. Trauma has a significant impact on hormone imbalance, be it current, recent, or childhood trauma. And then altered by transformation. By biotransformation, we mean liver detoxification of hormones and processing of hormones. Then infections also have an impact. Things like Epstein-Barr virus. Actually, now we see also with the SARS-CoV-2, any of those, the hepatitis viruses, all of these viruses called stealth viruses have a significant impact on the liver, and as a result, have an impact on hormones. Smoking as well, and as well as alcohol. So as a result of this complex web of interactions that influence hormones, and as a result, the myriad of drivers that can cause dysfunction, we see this wide spectrum of signs and symptoms and conditions that fall under hormone imbalance. So things like PMS, PCOS, menstrual irregularities, endometriosis, breast cancer, ovarian cancer, endometrial cancer, infertility, all of these things are conditions that occur as a result of hormone imbalance. And then, of course, common signs as well, things like hot flushes, breast tenderness, brain fog, fatigue, depression, hair loss. All of these are red flags for you to consider. Could my hormones be out of balance, and should I get them tested correctly? So in the functional medicine approach to hormone health, we always think outside the box. We don't just look at the ovaries and the traditional understanding of the role of hormones. So we think of very important questions when we are exploring our patient's history and understanding the underlying cause of the hormone imbalance. So we look at things like drug exposure. Have you had significant exposure to antibiotics in the past and recently? Are you taking a statin? Are you taking any NSAIDs, which are painkillers, or PPIs, which are stomach acid suppressants? Are receiving any hormone treatment like birth control or synthetic hormones or thyroid support? Have you done any surgeries, hysterectomies, laparoscopies, or gallbladder? Did you have any exposure to infertility drugs or experiencing infertility? Do you have dental work done or the presence of amalgams or inflammation in the mouth? How much stress are you currently under? Do you have a support system? Are you experiencing any anxiety? Are you exposed to xenoestrogens? And Farah is going to talk about this also in more detail. Gut health. Do you suffer from IBS or SIBO or constipation? What are the inflammatory foods that you might be having? Caffeine, sugar, and genetically modified alcohol, be it personal or family history, because we know the impact it travels through generation. And then history of physical or sexual abuse. 1 in every 3 women actually experiences physical or sexual abuse, and then 5 to 6 men, sorry for the typo there, But essentially, this is really important. The understanding the history of potential trauma is critical on hormone balance in the long term. So let's talk about estrogen, an understanding of it. There's three types of estrogen: estradiol, estrone, and estriol. And we're going to talk about each one of them. But before we do that, let's first try and understand where does estrogen fit in. So all your steroid hormones, your sex hormones, are produced from cholesterol. So it all starts with cholesterol. And going down the pathway, we see the production of estrogen here towards the end, with also its breakdown, with its breakdown into its metabolites and then excreted versions. So let's talk about this a little bit. I'm going to simplify it for you because I know this is really complicated. But what I want you to understand here is that there are certain areas of major influence in this pathway that can alter estrogen. And we have to look at all of them when we see a picture of estrogen imbalance in a female or a male. So for the first one is cholesterol. It's the sole precursor to steroids. Without cholesterol, you cannot make sex hormones. And that's why when people are on statins and there's a reduction of cholesterol, we need to assess hormone health because that could be driving it. That's why one of the things I mentioned is what drugs are you exposed to? Steroid production occurs in the mitochondria, which are those energy producing organelles that are inside all of your cells. For cholesterol to get into the mitochondria so that it can undergo synthesis into steroid hormones, it dependent on your thyroid hormone. So if you have imbalance in your thyroid, that will reduce cholesterol transportation and would impact as a result knock-on effect on the steroid pathway. Okay, if we have excess cholesterol, again, that's going to impact your steroid pathway. Then we go down the track. Another key point is cortisol. If there is a high demand for cortisol by the body because you're under trauma or stress, or chronic stress, or experience trauma, or you have a disease or infection or inflammatory condition or cancer, then you have an increased demand for cortisol that acts as a detriment to your other hormones. So basically, it reduces progesterone production and it reduces production of DHEA, testosterone, and therefore estrogens. And why is this important? Because when you think about the steroid pathway, think of it as all train tracks coming from the same station. So it starts with cholesterol, and then it can go down aldosterone, cortisol. It has to be basically distributed across those three train tracks. And so if we have more pull towards one train track, we're going to have less going towards the others. And then the third one is the aromatase enzyme. So your estrogen actually comes from testosterone. So you have to make testosterone first and then convert it to estrogen. How you convert it is by an enzyme called aromatase. And this enzyme is incredibly sensitive to your environment and the level of inflammation in your body. So if you have insulin resistance, if you're overweight, if you are taking xenoestrogens, if you're drinking excess amounts of alcohol, high intake of sugar, all of this is going to impact your aromatase enzyme activity, driving it to produce more estrogen. There's also the flip side where it also you can block aromatase activity and end up producing less estrogen. And then finally, it's the metabolism. So estrogen metabolism is dependent on liver and gut function. I will talk about this in detail. So these are determined by lifestyle, toxin exposure, genetics, and exposure to drugs, as well as infections, as I mentioned earlier. So you can see from the slide, there are so many areas here in which estrogen can be impacted, and all of these must be assessed before we decide on a treatment plan for correcting the imbalance. So let's now zoom in on estrogen. So there's three types of estrogen. Traditionally, and this is of course still true, it's when we think about hormone female health, we think about estrogen is the hormone that's most predominant in reproductive years, and it's there to maintain a healthy uterine lining. When estrone is what's most prominent in menopause, during menopause and postmenopause. And then estriol is the one that is only present during pregnancy. It's produced by the placenta, and it helps in contain a thick lining that provide blood to the placenta. Now, all of these are secreted by the granulosa cells of the ovarian follicles or the testes in men, the corpus luteum, which is responsible for the production of progesterone actually, and your placenta. Their production will depend on, as I mentioned, the enzyme aromatase, which converts testosterone to estradiol and androstenedione to estrone. Estradiol production is also regulated by FSH and LH. So that's why the health of your hypothalamus and the pituitary gland are so critical for also estrogen function. However, this is not the only role of estrogens. They actually work throughout the entire body. So you look at estrogen receptors, they are everywhere. They are present in the central nervous system, the skin, the endothelium, heart, breast, liver, and that's because they're present everywhere. They're efficacious. The result is that when you have an imbalance, you end up with this wide range of signs, symptoms, and conditions. So really, the key message is that estrogen is the glue that keeps the body whole and healthy, and it maintains metabolic homeostasis, cardiovascular health, immune, cognitive, and emotional function. If estrogen is out of balance, all of these systems are out of balance. So that's why correcting estrogen in the right way by addressing the root cause is so critical for your overall health. So okay, we talked about how you make estrogen and how the body uses it, or the benefit of it for the rest of the body. So you can take it, or you can make it, or you can take it, of course, externally, and then you use it. Then what where does it go? What happens with that estrogen? Nothing in the body is just everything is recycled in the body. So it has to be eliminated, and the way it's eliminated is through the liver and then through the gut and urine. So you can see here through the liver, it goes through phase 1 and phase 2, and then afterwards it's excreted, mainly through stool, through the gut, and then also through urine. So estrogen detox through the liver is key because it helps us understand estrogen dominance, and it also helps us understand and reduce risk of cancer. The reason being is if you look down the line, down the green arrows, what we really want is more smiley faces. We want to produce more of the good estrogen metabolite number 2. Okay, so the 2OH is the good, 16OH is a little bit inflammatory but doesn't cause DNA damage or increased risk of cancer, and 4OH is unfortunately very, very damaging, and it produces quinones, which essentially damage the DNA and leading to increased risk of mutation and cancer. But the body is very clever. If it is able to neutralize that 4OH when it's produced, if it has sufficient glutathione, which is the master antioxidant in the body. And that is going to depend on the overall health of your system, nutritional sufficiency, and so on. Farha is going to go into detail into this more shortly. And then once we've produced the 2, the 4, the 16, then the body has to neutralize it. And that happens through the MTHFR and the COMT enzymes, the pathways. And this way it makes it safe for excretion. So when they're in these phases, they're still unstable. So that's why it's really important, because it's really important for us to understand that elimination in the liver as a first step. And here, I don't want you to be alarmed by the information on this graphic. What I want to highlight is for the liver to do its job and to effectively metabolize estrogen safely and make it readily available for excretion is a nutritionally demanding process. It requires a high amount of B vitamins, magnesiums, amino acids, and so on, fats, etc. And Farah is going to cover this in more detail. So that's why it's so critical the lifestyle that you lead, the food you eat, the toxins you're exposed to are so important for this process. The second part is really your estrobolome. So this is where the gut plays an important role in regulating estrogen. So estrogen, let me walk you through this. Estrogen produced in the ovaries, circulates in the blood, hits all the receptors, does its job, then travels back to the liver, and then it's broken down and deactivated into the 2, 4, or 16, and then it's neutralized, and then it's deposited into the bile to be excreted in the intestines and in the stool. Now, the gut regulates this circulating estrogen via an
أما
enzyme
فيك نعملها
called
ميوت هيك.
beta glucuronidase. So this enzyme breaks down estrogen into a free or biologically active form. So what that means is, if you just think of it that way, the liver wraps it up and ties it in a bow and then sends it to the gut. And if we have too much of this beta glucuronidase enzyme, it basically unties the present, and estrogen can get out and go back into the bloodstream. And that drives estrogen dominance, increases the level of estrogen in the body. So the path to estrogen is that in a healthy microbiome, if you have healthy ovaries, healthy body, no inflammation, effective liver, and healthy gut, most of the estrogen exits the body and you have no issues. In an unhealthy microbiome, that creates an inflammatory process across the whole system, and you have an elevation of the beta glucuronidase enzyme, then you end up recycling so much of that broken down estrogen back into the bloodstream, causing havoc in the system. So let's talk about estrogen dominance. Too much of a good thing can be bad. So what is estrogen dominance? Relatively high estrogen compared to progesterone. That's what it means. It doesn't mean that your estrogen has to be above the normal limit. It only means that the estrogen and progesterone, may still be within normal range, but the estrogen level is higher than the progesterone, especially if we're assessing in the luteal phase, which is post-ovulation, because that's going to have a significant impact on fertility. Estrogen can also be low, but if P is lower, then we know there's an imbalance in that ratio. Now, there is no perfect ratio because it varies between patient to patient, but it's how you take everything into consideration when you look at the result. And the signs and symptoms are driven by those effects of estrogen they have on the receptors that are across the whole body. So if you can end up with hyperproliferation, you get more fibroids in the breast, in the breast. You can end up with increased risk of cancer, and you can have like prolonged exposure can also lead to PMS symptoms or PCOS and so on, and infertility. So symptoms, I just want you to know that when you experience any of those symptoms, it's really important to think, do I have estrogen dominance? I should get it checked. Swollen or engorged breast tenderness, water retention or bloating, irritability, mood swings, headaches, memory difficulty, sweet cravings, excessive sweets craving, low or lost sex drive. Really important to think about these symptoms and wonder whether estrogen is at play. Signs and associated conditions, painful breasts, fibrocystic breasts, irregular menses, PCOS, fibroids, etc. So what drives it? As I mentioned, diet. And Farah is going to go into this in detail. Okay, so if you have a deficiency in phytoestrogens, one that are helpful in the metabolism of estrogen, safe metabolism of estrogen, eating sugar and refined starches. If you have high cortisol, as I mentioned, because that leads to that impacts the entire steroidogenic pathway. Do you have anovulatory cycles? So you have very low progesterone and you're not actually ovulating. As a result, estrogen is dominant, even though on a blood panel, it might look it's within normal range. Are you taking birth control pills, which actually impact metabolism and can drive estrogen dominance that way? As well as, do you have poor sleep? Do you have poor nutritional intake, or bad meal timing, or you have deficiencies in your mitochondria? So if your mitochondria is not functioning well, you cannot effectively produce hormones well, and if you have exposure to toxins. So let's talk about deficiency, the flip side. So a deficiency doesn't just occur post-menopause. Okay, so we know that estrogen drifts with age, that higher estrogen levels gives us better metabolic health. And then as we see with women as they age into their 50s and 60s, estrogen drops, and that drives more chronic disease. We see more visceral fat that drives more inflammation, and that impacts the development of chronic disease. However, Low estrogen can also be induced chemically or surgically. So whether you had to have a hysterectomy or gallbladder removed, or you take birth control pills, or any, to be honest, hormone replacement therapy or hormone correction therapy, be it pill or be injection, or infertility drugs. So low estrogen can be induced, if you go back to that graph, by stress. So stress can lead to low estrogen because it blocks it blocks the pathway from going further down by stealing more of the precursors towards cortisol production. Also, poor conversion. So we're unable to convert testosterone into estradiol, and then of course that excess testosterone leads to a lot more different types of issues in women. And then estradiol and estradiol, if we have an increased sex hormone binding globulin, that means more of the estrogen is bound, and therefore it's not available for it to exert an effect. So symptoms of low estrogen, there's actually some similarities between low and high estrogen, but ones that are important is irregular or missed periods, hot flushes, pain during intercourse, vaginal dryness, or vaginal loosening. Really important to think about those, and low estrogen if those do occur, especially if it's premenopause. And so when we think about estrogen, what's critical is that the protective effects of estrogen start to disappear with aging and or with estrogen deprivation. So if your estrogen is dropping, you end up with cardiovascular complications, osteoporosis, cognitive decline, increased blood pressure. And so that's why it's really important for women to balance their estrogen because of its incredibly protective effects on your health. So how do we influence? What can you do? It's not all doom and gloom. Uh, so just a reminder, ways to affect estrogen levels. Okay, so because it's a complex pathway as I described, and there are so many potential areas of intervention or where things can go wrong. I just wanted to remind you here that, for example, giving a statin would reduce cholesterol and as a result end up in reduction of estrogen. If we have an adrenal steal because there's too much stress, that's going to reduce your estrogen. If we have insulin resistance, that's going to increase estrogen levels. If we're going to have peripheral, I'm not going to go into the details of this because it will get complicated. But again, any of those interventions that you see on the right can lead to either an increase, decrease, or a mix or a change in the ratio of estrogen metabolites, and also can impact excretion down the line. So that's why we've got to assess everything in totality. So first, test, don't guess. Always test sex hormones early in the morning. Serum is optimal. If you're going to do serum hormone, its optimal window to test is, I'm only covering the estrogen here, but for LH and FSH, it's between day 3 to 4. And then estradiol is day 7. And then the sex hormone binding globulin can be any day. Because remember, LH and FSH impact estrogen production. Estrogen is highest in the first half of the period. And then it's important to measure at day 7 because that's where it's at highest. That's what we want to measure. And then sex hormone binding globulin gives us an indication of how much is free and available to give to provide action versus that's bound to this protein. Personally, I prefer for all women, to be honest, to do the advanced testing through Dutch Plus, which is urine and saliva collection. And the Dutch Plus gives you, as you can see, the entire pathway. So you can see exactly how much you're producing of all your hormones plus their metabolites, and gives you an indication of how are you breaking down your estrogen, in what ratio, and are you capable of then pushing it through phase 2 to neutralize those metabolites and prepare it for excretion. You also want to look beyond hormones. Just doing the Dutch test is not sufficient, because if you just do the Dutch, then okay, we can see there's imbalances, but we haven't really looked at, well, what's going on in the liver in more detail, what's going on in the gut. Do we have any genetic SNPs that might be impacting impacting the activity of the liver. So that's why it's important to look beyond hormones with things like genetic SNPs for MTHFR and COMT. And I've put an example here. Important to look at gut health because we want to see that beta glucuronidase enzyme, is it elevated or is it low? Do we have an imbalance in the gut flora? Do we have the presence of pathogenic bacteria that can impact estrogen metabolism and hormone health overall? Insulin resistance, again, encourage you to watch the PCOS talk because insulin resistance is at the core of so much hormone imbalance. A lipid panel. So what is your cholesterol? What is it doing? What are the levels of LDL, HDL, and so on. And then thyroid function, because that's really important in kickstarting the steroidogenic pathway. And then nutritional status, as we mentioned, because that's very critical for detoxification. So correct the imbalance by removing the environmental triggers, supporting healthy detoxification, correct insulin and lipid imbalance, address nutritional deficiencies, reduce stress, and finally, and of course, gut health, and I'm going to cover this in more detail in a second, but once if all of this is corrected and you still have a hormone imbalance, then a hormone intervention is warranted. Of course, when you work with someone who is experienced in hormone balance or functional medicine practitioner, nutritionist, they are able to combine a lot of the treatment plan to target all of these at the same time. So love your gut and your liver because that will lead to healthy hormones. That's a key message. You want to avoid antibiotics unless it's absolutely necessary. Minimize exposure to toxins. Modify your diet. Reevaluate contraceptive methods. Again, birth control pills, they damage the microbiome. They promote candida overgrowth and SIBO, and that results in elevated beta glucuronidase and estrogen recycling. You want to then have fermented food, probiotics, prebiotics, and optimize your intestinal environment, especially if you have low digestive and absorptive capacity. So remember that hormone correction is an art, it's not a science. We have to take into consideration the full picture and look at where on the steroidogenic pathway is the imbalance in the system pulling that's resulting in the either increase or decrease in estrogen balance. So when it comes to hormone imbalance, always look for and address the root cause or causes. Don't just adjust the hormone straight away because that could lead to long-term effects and chronic conditions. And always treat the gals. Look at the gut, the adrenals, the liver, and the sensitivity to both insulin and thyroid hormone, because those are critical in hormone balance, but also hormone production, as we discussed earlier. Thank you. I'll pass over now to Farah.
Thank you very much, Amal. That was extremely informative, as always.
Thank you.
Okay, so let me share my slides. Okay. So I will take it basically from where Amal stopped and discuss a bunch of lifestyle factors that we can use in order to better control our estrogen levels and hormones in general. So these are the factors that tend to, sorry, let me just put this. So these are the factors that affect estrogen levels. So of course, poor diet. So diet, if our diet is high in alcohol, sugar, trans fat, even saturated fat, or rich in meat products, those can have a negative effect on our estrogen levels. Obesity, high fat stores. So estrogen can be produced and released by adipocytes or fat cells. So we'll talk about this in a little bit more detail. Alcohol. So the way we metabolize estrogen or detoxify estrogen, it's similar, or in a way, we also detoxify alcohol through the liver as well. So the liver basically, or the alcohol can push estrogen aside and use up all the factors that are required for estrogen breakdown, metabolism, and metabolizing it. And then as a result, we can get elevated levels of estrogen. So alcohol can really negatively affect estrogen levels and can be or should be a no-no. Again, we'll talk about this in more detail. High insulin levels, certain medications, overexposures to chemicals, pesticides. Again, they are all over. And as uh, as much as we can to minimize our exposures to all of these chemicals, again, that can not only impact estrogen levels, but affect the function of the thyroid, um, cortisol, pretty much everything and anything. And then genetics. So even with genetics, Amal mentioned some very important genes that have crucial roles to play in terms of metabolizing uh, estrogen. However, we can still have those genes, but not experience any, let's say, any symptom. Okay, so again, genes, the role of genes, epigenetics, how our environment influences genes is really important. Okay, so even if you've done a genetic test and it's shown that you have certain mutations or even or SNPs, as we say, and the genes that are important in estrogen metabolism, it does not mean that this is, you're going to struggle. So very quickly, once again, what makes it or breaks it is how we break it down, metabolize it, and how we get rid of it. So there are different phases, as Amal mentioned, that are involved, and there are different types of estrogens. So we know that estrone, E1, is transformed into 2-OH, estrogen, 4-OH, and 16-OH. The beneficial, let's say, or protective one is the 2-OH, as opposed to the 4-OH and the 16-OH that could be quite risky. So we can see a variety of different foods, a variety of different nutrients that can impact the conversion of this E1 to either 2-OH, 4-OH, 16-OH. So some of the positive factors, let's say, that can promote or increase 2-OH, eating things like berries, cruciferous vegetables, flax seeds rich in lignans, rosemary, exercise, and then two compounds that we'll talk about, indole 3-carbon and DIM. The negative things that can, let's say, prevent estrone being converted to the beneficial 2-OH type is a diet high in sugar, high in omega-6 fats, which tend to mostly come in our diet from vegetable oils, and then chemicals and xenoestrogens as well. Now, what can promote the formation of the 16-OH, and that's of course not a good thing, is pesticide, smoking, caffeine, some medications, and thyroid imbalances. And then what can have a protective effect, so to reduce the conversion to the dangerous or the riskier 16-OH, is things like grapefruit, rosemary, and peppermint oil. So again, increasing the beneficial 2-OH estrogen through moderate exercise. Remember that sometimes intense physical activity can actually negatively impact hormones. Okay, so if you have a hormonal imbalance, it's always a good idea to scale back, cut down on your intense exercise regimen, and then let's say if you're doing 4 times a week, maybe cut down to 2, and then substitute it with more yoga, Pilates, sort of lower intensity exercise. Cruciferous vegetables, I'm going to talk about that quite a bit. So broccoli derivatives, sulforaphane, flax, omega-3 fats, as I mentioned, turmeric, stress management, and of course, maintaining a healthy weight. So if we look at this, we can see that there are so many nutrients and bioactive compounds that, that play a role in different stages in terms of the estrogen metabolites. Okay, so whether it's modifying the estrogen receptor activity, okay, lignans, DIM, indole 3-carbon, whether it's inhibiting the activity of aromatase, which is converting more the testosterone to estrogen. Okay, so for example, again, lignans, flavonoids, whether it's supporting methylation. Okay, so you've got the B vitamins, magnesium. So there is so much potential in terms of nutrition, the vitamins, the minerals that we're taking in, the foods that we're consuming, and how these can affect metabolism and excretion, or ultimately the fate of estrogen. So again, this is the liver. Liver detoxification is very complex. Okay, so just juicing, going on a 5-day juice is great. It gives the digestive system a rest, but we really need to dig deep into a person's ability to detoxify, provide them with extra nutrients, extra support, botanical support, nutrients to support these phases. So as we can see, phase one produces the 2OH, 4OH, and 6 and 6. Sorry, there's a bit of a typo over there, and the 16OH. The nutrients that are needed, again, B vitamins, folic acid, glutathione. And then in phase two, so methylation, glucuronidation, we need, again, a bunch of different nutrients. Once again, methylated B vitamins, magnesium, vitamin D, choline. So phase one detoxification relies heavily, and this is in the context of estrogen, on DIM and indole 3 carbon. When we look into our diet, we find those in cruciferous vegetables. Okay, so our cabbage, our cauliflower, the kale, the bok choy, Brussels sprouts, okay, different types of cabbages, again, turnips. So those are extremely important and can upregulate or support phase one detoxification, which produces the different types of estrogens. In terms of phase two detoxifications, again, there are so many other nutrients that are important, but this is in the context of estrogen. So choline, which we find in eggs, beef, chicken, quinoa, beans, folate, okay, so vitamin B9, your green leafy vegetables, your avocados, your beans and chickpeas and lentils, magnesium, avocados, pumpkin seeds, dark chocolate, vitamin B6, we can find that in chicken, different seeds, and B12, which we only find in animal food. So if you're a vegan, definitely something to keep in mind that you would need, very likely you would need to supplement with vitamin B12. So those nutrients are all needed in order to support phase two detoxification. So when we metabolize estrogen, okay, again, it's going through the liver, through the different detox pathways in the liver, and then from there, it goes to the gut. What happens in the gut, as Amal again mentioned, okay, so as Amal mentioned, if we have dysbiosis, so an imbalance in good versus not so good bacteria, then there are certain bacteria that can stimulate the enzyme beta glucuronidase. What happens to this, or the effect of beta glucuronidase, is that it's going to recycle estrogen. Okay, so after detoxification in the liver, estrogen can either be released through the urine or through stool. If it's going through stool, it's going through the gut. And if there is an overgrowth of certain bacteria that produce beta glucuronidase, this is likely going to recirculate estrogen. Okay, and then what's going to happen is over time, estrogen levels are going to increase and all the symptoms that we've mentioned before. Okay, so some estrogen metabolites, again, can be excreted back to the gut via the bile. If there are certain bacteria that are overgrown, let's say, then this could further lead to recycling of estrogen. So some potential, so this is the estrobolome. Okay, this is basically the microbiome, the effect of the microbiome on estrogen. And some of the things that we can take to reduce beta glucuronidase is certain probiotic strains like L-acidophilus, calcium D-glucarate, and lignans. Okay, so again, this is just to help manage beta glucuronidase, but then we really have to look at the gut. Okay, we have to remove any triggers, things like gluten, dairy, anything that could negatively be affecting the gut. We have to reduce inflammation. We have to heal the gut. We have to make sure that the individual is pooping on a regular basis. Okay, so we have to increase microbial diversity. We really have to treat the dysbiosis, and this can be done through certain antimicrobials. So I did mention lignans, and these can help reduce beta glucuronidase. So isoflavones and lignans are phytoestrogens. So the phytoestrogens are phytonutrients found in plant-based foods. These can interact with estrogen receptors, but they are not estrogen. So there's a lot of worry about soy. Shall I eat soy and estrogen? Okay, now if you're a man, if you're a child, then we might want to be cautious how much soy you're eating, okay? So phytoestrogens usually bind weakly to estrogen receptors, and they can effectively block estradiol. So what they can do is that they can increase SHBG, They can decrease aromatase, which converts testosterone to estrogen, and promote the good 2OH for the beneficial, let's say, versus the riskier type. Okay, so again, this serum hormone binding globulin, or sorry, sex hormone binding globulin can help bind estrogen. Okay, so again, it has, or phytoestrogens have a protective role. So phytoestrogens, again, soy, but then seeds, sunflower seeds, flax seeds, sesame seeds, legumes, whole grains. So flax seeds can increase sex hormone binding globulin, again, that binds to estrogen. It inhibits aromatase, and even having 2 tablespoons a day of ground flax seeds for 7 weeks has been shown to be effective actually for post-menopausal women, and it increases the 2OH instead of the 16OH. So have your flax seeds ground. You can always add a tablespoon or 2, just drink it with water. It can really help with constipation as well, or add it to your smoothie, soup, etc. Cruciferous vegetables, so sulforaphane. When we talk about estrogen, we cannot talk about estrogen without talking about sulforaphane. So we find this in broccoli, cabbage, Brussels sprouts, kale, cauliflower. So sulforaphane is what we get. So we start off with glucoraphanin. Okay, so glucoraphanin, it's a phytonutrient that is found in cruciferous vegetables. It has so many health benefits. So it can help reduce inflammation, oxidative stress. It can promote detoxification. So when the enzyme myrosinase, which is also found in cruciferous vegetables, when myrosinase acts on glucoraphanin, we end up with sulforaphane. Okay, so sulforaphane is really what's shown to be very beneficial in terms of estrogen control. Now, the best way to have our, let's say, broccoli, especially broccoli and broccoli sprouts, those two are extremely, extremely rich in sulforaphane. When we chew, when we chop them off and automatically eat them. Okay, so this really activates the myrosinase. When you cook them, so it really depends how you cook. Heating usually will damage a myrosinase, especially when you heat for a longer period of time. If you're heating it for a couple of minutes, literally a minute or two, actually research has shown that this will increase sulforaphane. But if you heat it for longer periods of time, even up to 5 minutes, this can drastically reduce the sulforaphane. And the way you cook it makes all the difference. So when you boil broccoli, actually you're losing a lot of nutrients, and including sulforaphane, as opposed to steaming. When you steam for a minute, up to 3 minutes, that's fine. You're maximizing sulforaphane. If you are steaming it for longer, then you are reducing sulforaphane. Freezing. Okay, if you're buying frozen broccoli as opposed to fresh broccoli can have 10 times the amount of sulforaphane. Okay, so it's best to have your broccoli fresh. Try to consume it as much as possible. The longer you store it for, the less nutrients and sulforaphane it's going to have. There's also some research that demonstrates if we add mustard powder to, well, actually the research focuses on sulforaphane powder as opposed to actual broccoli pieces. So if we add mustard seed powder to sulforaphane powder, this can really help improve absorption, or it increases the content. Okay, so even though research does not for now support adding mustard seeds, let's say, to actual broccoli, I don't find any harm in doing so. So go ahead and boost your sulforaphane intake. So add some mustard seed powder or mustard seeds to your broccoli. Broccoli sprouts, I personally never tried to do them at home. That's on my to-do list. But if you have the time, if you're willing to do so, then go ahead. Because the ones that we find in the supermarket, the longer they're there on the shelves, again, the less sulforaphane they're going to have. So sulforaphane, when you sprout them, the minute they start to sprout, 3 to 4 days later, that's the maximum amount of sulforaphane. Okay, so broccoli sprouts can really support detoxification, support a healthy gut, reduce inflammation, protects against oxidative stress. Okay, so open air storage, storing in a plastic bag, is going to reduce the glucosinolates, sulforaphane in a few days. Okay, so broccoli sprouts can have at least 10 times more sulforaphane than actual broccoli. So adding them to smoothies, to salads, sprinkling them again in a sandwich, or I think smoothies and salads is really the best way. You can have them in powder form. Um, in order for us to, to get enough sulforaphane, we would have to eat quite a bit of cruciferous vegetables, so about 500 grams. So it's quite a bit. Some people can resort to taking it in a supplement form, a powder form, but we always say try to get it from food, because you're getting in so many other important nutrients as well. So other factors that can affect estrogen metabolism: alcohol. Okay, even that one drink a day, or not even a day, even that one drink a week, a month, can possibly have a negative effect. Okay, so if it's you're invited to a wedding, you're invited to an occasion, if it's the holiday season is coming up, just be mindful how much alcohol you're taking, and do know that this will affect your cycle. So it's try to be mindful about how much you take. Okay, alcohol is alcohol is alcohol, even if it's whatever type of alcohol. Okay, it's liquid sugar, but it's all the same. It's all going to have a negative effect in terms of estrogen metabolism. It can increase the body's ability to detoxify estrogen. Obesity, again, fat cells make aromatase. Having too many fat cells can increase estrogen. It reduces the 2-OH estrone and increases the 16-OH. And then it reduces, again, the sex hormone binding globulin. Insulin resistance. So insulin resistance can also increase aromatase, and it can also affect or impact detoxification, and in general, all other female hormones as well. So diet, as I mentioned, cruciferous vegetables, green leafy vegetables, eating more fiber. Okay, so fiber, like when we spoke about beta-glucuronidase, fiber can really help promote those beneficial gut microbes. Okay, so shifting it to a more beneficial state as opposed to a more disease-forming state. Lignin-rich foods, flax seeds, bran, focusing on healthy fats like avocado, extra virgin olive oil, nuts, seeds. Those are very anti-inflammatory. Okay, so we really also want to reduce the overall inflammation that could be in our body, that could be affecting our hormone levels as well. Anti-inflammatory foods, rosemary, okay, has rosmarinic acid, which is a very important, potent compound that can also help balance estrogen levels. Turmeric, green tea, which contains ECGC, berries, vegetables in general, ditching the inflammatory foods, dairy, vegetable oils, sugar, alcohol. If you're in a state of gut healing, I would also suggest removing gluten and feeding your gut microbes with probiotics and prebiotics. Okay, so again, probiotics, for example, coconut-based kefir, coconut-based yogurt made with added cultures, apple cider vinegar with mother, kimchi, fermented vegetables, and then prebiotics like apples, onion, garlic, leeks, asparagus. And please make sure that you are pooping daily at least once. Okay, so if we are constipated, it can increase the risk of having dysbiosis, that balance of good versus not so good bacteria. Okay, so we need regular bowel movements. Okay, the longer this stool is there, the more likely we are going to be recycling our estrogen. We need to get rid of that estrogen through not only urine, but stool as well. And then lifestyle. Okay, so in addition to diet, we can talk about diet all we want, but we cannot ignore the fact that stress management, exercise will play a big role. So movement gets the lymphatic system moving, the blood flowing. When we sweat, we get rid of toxins. Meditating, of course, will help stimulate the vagal tone, the vagal nerve, which will stimulate the parasympathetic rest, digest, repair, detoxify system. And then reducing our toxic burden. Endocrine disrupting chemicals, xenoestrogens can act like estrogen. Sometimes we could be doing all the right things, but then we are hitting a wall. And this could be because we are exposed to so many toxins. Okay, so taking it a step at a time, focusing on the beauty care products that you use, the nail polish, the makeup, the detergents, even things like your carpets and your mattresses. And these all, we have to switch at least the products that we're using to more eco-friendly, organic, hopefully plant-based products. because they make such a big difference. These xenoestrogens that act like estrogen and can really, they mimic estrogen, and they can affect all other hormones as well. Okay, so thyroid, they're linked to cancer, they're linked to birth defects. Okay, so they affect hormones at every level. So BPA, flame retardants, phthalates, so those are all found even in the air fresheners. In case you switch to things like essential oils, for example, the food packages, receipts, opt for, let's say, having them send you an email, receipt by email. Plastics, never, of course, cook your food in plastic, or store your food, or heat your food in a microwave in plastic, store your food in glass containers. So making it a step-by-step change, because ultimately it's going to be doing you a lot of good and your family as well. So these are a bunch of different toxic ingredients to avoid that we find all over. Okay, so makeup, as I mentioned, things that we might take for granted, wearing nail polish. These all contain chemicals, sorry to say. Chemicals as well in our food. So this is the Environmental Working Group releases every year the Dirty Dozen and Clean 15. So this is the Dirty Dozen. Basically, it's the fruits, veggies that tend to accumulate most herbicides, pesticides, chemicals. Okay, so if you want to choose organic, go for those foods as organic. Okay, we know that organic foods are not always available, they can be pricier. So the Clean 15 list, those are the foods that tend to accumulate the least amount of chemicals. Okay, so again, if you want to choose organic, go for organic strawberries, spinach, kale, everything on the Dirty Dozen list. So the 2020, this is the most recent one. And you tend to find actually every year pretty much the same or similar foods. Sleep. Okay, so exercise. Again, remember when I mentioned about exercise, too high intensity exercise can be a negative thing. So scale back, and take it easy. Sleep. Sleep will affect hormones. Hormones will affect sleep, and you're not going to be a happy person either way. So estradiol can really make the brain more sensitive to things like dopamine. It can trigger the release of serotonin. So this is going to affect mood, sleep. Estrogen can really contribute to higher quality sleep, fewer awakenings during the night, and then less time it would take you to go to bed or to fall asleep. And then, if we look at this figure over here, again, through our circadian rhythm or our circadian cycle, things take place at certain times, and we really have to appreciate that, hormones fluctuate during the day. Okay, so good quality sleep where we go to bed around 10:30 p.m., wake up, some people will say 5, 6 a.m., getting at least 7 to 8 hours of sleep in a total dark bedroom, switch the Wi-Fi off, that could really help support hormone levels. And then finally, supplements. So we want to supplement, to support the liver, things like N-acetylcysteine, milk thistle, curcumin, resveratrol, green tea, zinc, selenium, magnesium. Those can all help support liver detoxification. Omega-3 fats, of course, are anti-inflammatory. Magnesium will support the COMT gene, one of the genes that also affects estrogen metabolism. Magnesium also supports liver detoxification. Methylation, so we support methylation with things like vitamin D, B vitamins, active B vitamins, methylated folic acid, methylated vitamin B12, DIM, indole 3 carbon, and then calcium D glucarate can help bring down that beta glucuronidase. Okay, so support your genes, okay, with nutrients, with vitamins, minerals. Okay, so selenium, curcumin, vitamin D, magnesium. Stress management can also really help switch off those genes that can negatively affect estrogen metabolism. So balance your hormones naturally. Okay, we can, but we have to look at the liver, we have to look at the pancreas, we have to look at the lymphatic system, we have to look at the gut, we have to look at the skin, we have to look at all of these. It's really a very comprehensive, holistic approach. I did want to put this slide in here. If you are taking birth control, or a lot of doctors will automatically, if someone has a hormone imbalance, they will automatically put them on birth control. These are all the different ways that birth control can negatively impact our bodies. It can lead to several nutrient depletions. Okay, so vitamin E, vitamin C, B vitamin, selenium, zinc, magnesium. So if you are on the birth control, please focus on having a bunch of these foods that will give you these nutrients, and then discuss it with your doctor, discuss it with a functional medicine practitioner, again, in order, especially if you're still struggling with symptoms, to see what you can do to support your body overall. So thank you so much. I think that was, oh no, hold on. I did have one more slide. So these are a bunch of resources. If you do want to get reading on estrogen, I love all of these women. They are fantastic, doctors or functional medicine practitioners. Their books are really informative. Okay, so you've got Dr. Jolene Bryden, Dr. Lara Biden, Dr. Aviva Rom. I would highly recommend looking into these books and resources. And I do have a recipe here for you. This is my seed cycling pesto recipe, modified from actually one of the previous, doctors. So seed cycling is also a big thing. And this is where you, according to your cycle, so the first, let's say the follicular phase, you are having, let's say, flax seeds, you are having pumpkin seeds. So pumpkin seeds and flax seeds during the follicular phase to stimulate the production, let's say, of FSH, LH, estrogen. And then during the luteal phase, where we are trying to boost progesterone production, we take in sesame seeds and sunflower seeds. So you can always make a pesto, throw in some seeds according to when your cycle is. And this is my email, my Instagram account, Amal. Your email is, I believe, hello@amalsmail.com, if I'm not mistaken. I should have put it in there as well.
Thank you, Farah.